increases are shown in about 6 of the provinces. And that's why it's important for us to now recognize that this now is a second wave. The majority of the new cases are from Western Cape, and that is 30% of the positive cases today in the 24 hours are from Western Cape, followed by Eastern Cape, which is at 24%, then KwaZulu-Natal, which is 23%, and Gauteng province, which is 17%. These together are indicating the provinces that are driving the numbers that are going up at this point. Free State, Limpopo, Mpumalanga, and Northwest each account for 1% of the new cases respectively. And of course, Northern Cape even accounted for less than 1%. It's important to make this distinction because since the end of September, we had actually seen most of our numbers coming down to as low as around 1,000, just under 1,000. But now the numbers have started increasing. They first moved to about 2,000, but now they've moved much higher than that. It's important also to highlight that today we've breached the 6,000 mark in terms of new cases, and the total new cases identified are 6,079, which are giving us a total of 828,592 of cumulative cases today. If we go through the provinces, still the highest number of cumulative cases would be Gauteng, Western Cape, Eastern Cape, and KwaZulu-Natal. But we're looking at the day-to-day increases, which is where the concern has come from. There are other seriously concerning issues which I need to bring to the attention of the public. Firstly is that when we were on the plateau, we had actually had a positivity rate. That means for every batch of 100, we had a positivity rate of 10%, and we actually went a little bit less than 10%. So this was the ideal that even our Ministerial Advisory Committee had recommended, that would mean that we're still stable at that level. As of today, the rate is now at 18%. But if you go province by province, you actually find that some provinces are much higher than the 18%, and therefore that's the 18 now is the average for the whole country. That increase is an indication that we've moved from the time when we were at 10%. You'll also notice from the 7-day moving average graph that the increases, there's a rapid increase in KwaZulu-Natal and Gauteng, which is exponential. Now, I'll just try and see if I can show you the graph. It might be possible to show you the graph just to give you a sense of what numbers we are seeing. If you look at this graph, if you're looking at this graph, it's basically indicating that activity shows us where we were around June, July, August, where the first peak was. And we had a good lull for September, October, and early November. But if you look at the graph now, it's showing the numbers are already starting to rise. The first two at the top is Eastern Cape and Western Cape, but below them is KwaZulu-Natal and Gauteng. This is the one area that is a major source of concern for us. This rise is showing that it's going to be exponential growth. That means we must expect faster rising numbers with higher peak, possibly than the first wave. In the last 2 days, the age distribution has also showed a different pattern from the norm, and I want to share this with you. This is the peak age at this period is now 15 to 19 years of age group. Now, this is a new issue, and this is what's most worrying. It's believed to be due to a large number of parties involving young people drinking alcohol with no adherence to non-pharmaceutical interventions, wearing no mask and social distancing, and hand and sanitizing also not taking place. We have actually had a report that has come from KwaZulu-Natal from last week, where you could see this pattern is much more widespread than we thought. This inevitably leads to super spread activities, which spill over into the rest of the country as the age group is highly mobile and the majority of the carriers are largely asymptomatic. If this trajectory continues, our healthcare system will be overwhelmed by these numbers. Hence, part of the recommendations that are being tabled by provinces are now looking at how to contain these large gatherings and large parties. And this a proper decision will be made by the National Coronavirus Command Council as we look into some of these matters. We'd like to indicate that having observed the trends in the past few weeks, we had already sent a letter to all MECs urging them to prepare their respective provinces for a second wave. The key issues that we have raised for the provinces that they need to ensure that testing turnaround times are as quick as possible to facilitate patient flow, to assess the bed capacities, including recalling field hospital beds and reactivating them, and attending to staff and equipment needs urgently to tighten up monitoring and evaluation and reporting to the national department. It's important as well for us to be able to say, as we're moving around in the various provinces, we're seeing that the pressure has built up in a number of provinces already. And therefore, as we had said earlier, that the second wave is inevitable. I think we will now come to that point. Testing data at this point, 5.6 million tests have been conducted, and 38,200 have been conducted in the past 24 hours. Then previously we had also indicated that our NICD has migrated to a new system for capturing tests. There's a lot of activity in terms of improving our data at the back office. So we've done total PCR tests. We've given a figure of 5.6 million, but there are new PCR tests that have been done, and there are also retrospective antigen tests that have been done, and there are new tests that are being done. All of this, we're trying to catch up to make sure we don't miss out on anyone who could have been positive. And therefore, the total numbers now that are going to be coming through won't be representing the PCR tests that we have been doing all along. They'll also be indicating some of the antigen tests that would have been done. Regrettably, 135 COVID-19 related deaths have been reported. In the Eastern Cape, there are 56, Free State in 15, Gauteng 16, and KwaZulu-Natal 7, Western Cape 48. This brings the total number of deaths 22,574. We do wish to convey our condolences to the loved ones who have of the departed, and also thank all the health workers for doing all the work that they've done to treat all of these patients. But the recoveries have now stand at 754,658, and this is actually about 91.5% of patients who have recovered. So after visiting the provinces, the various provinces, now our reports are ready with recommendations that come from the provinces, provincial government, from the municipal government, and some of the stakeholders to look at what needs to be done, particularly in these three areas where we've got a belt from Nelson Mandela Bay to Sarah Bartman and to the Garden Route District Council. All of that is now prepared for the National Coronavirus Command Council, and the cabinet will therefore, after that, take the decision on that. There has also been a request that has been made for all the provinces to, given the experience that they are going through now, to give us suggestions of what needs to be done as we manage the festive season. I think it's important to send a message to all South Africans that yes, festive seasons are the time for us to relax and enjoy with our families. It's time for us to enjoy, but we now need to understand that we have got a responsibility to enjoy with various restraints. And these restraints are to make sure that it is not a responsible way to enjoy yourself to the detriment of other fellow South Africans. If our enjoyment is going to lead to more people being infected and getting sick and getting admitted into hospital, and even some losing lives, it's not a responsible way of enjoying ourselves. So we need to then be prepared to enjoy a festive season with a difference. And of course, the National Coronavirus Council, the Provincial the Presidential Coordinating Council, and the Cabinet will deliberate on these matters. And then, of course, we will get a proper direction of what needs to be done when the President addresses the nation in due course. At this point, we believe that it's important to make South Africans be aware that the situation is rather concerning, and this is why we thought that we must just clarify some of the situation that we are going through. Thank you very much.
SABC.
So this is Crisaldo Lewis. We're live in the Full View studios here at the SABC. I'm hoping you can hear me. In light of what you have announced to South Africans this evening of entering the second wave, is there a likelihood that South Africa could revert to a stricter lockdown before Christmas?
I think we should take all the plans and the proposals that are coming from the provincial governments and the district municipalities and the various stakeholders, so that we table them for consideration by the National Coronavirus Command Council and Cabinet, and therefore decisions get taken at that level. Without being able to know exactly what level of restrictions, but I think it's important for us to be able to say that there has to be some way of encouraging more responsible behavior. There must be a way of how we protect South Africans from a kind of conduct that is showing a lot of complacency. So we need to really focus on those containment measures that we have always preached about: use of masks, the use of distancing and sanitizers and so on. And of course, once there's all of these issues have been tabled together, we can then give you a much more definitive answer in terms of what do we see as the best way to go forward. But that will be after the Cabinet has deliberated, and of course, the President having given the address, then we'll be able to get a very clear direction.
Newsroom.
All right, the media all being allowed one question each to ask the Minister of Health here in South Africa, Dr. Zweli Mkhize, announcing to the public this evening that South Africa has officially...
Sorry, I just had to mute Crisaldo. Is ENCA ready to ask their question? ENCA?
Minister, the ENCA had requested that if they can't get through, we do ask the question on their behalf. They've already sent the question. Sally from ENCA, the question is, just as calls for behavioral change have not worked, is another lockdown still part of the measures being considered if we do not get infections under control? And I think, Minister, it is linked to the previous question.
Well, I cannot say that the change of behavior that has been called for was never implemented. In the earlier days when we went through the first wave, we attributed some of the decline in numbers on the fact that people had started using masks. And if you compare with what had happened at the beginning of the pandemic in March, where no one wore a mask, and to what was happening towards the middle of the year, there was quite a lot of wearing of masks, and people were very loyal to the issues of distancing. And so not necessarily everybody did that, but the majority did it in such a way that we thought that they created a critical mass that made it possible for the infection to kind of recede. Although there may be other factors that were associated, which we may not necessarily fully understand, but we believe that there was a huge contribution from that behavioral change. What I think is important at this point is to actually re-emphasize the need for behavioral change, that complacency is not going to help us. Fatigue on COVID fatigue, where people think that, well, it doesn't matter anymore, is actually going to matter. And I think that our focus has to be about how do we strengthen the behavioral change in all the countries that they've been able to assist, that have been able to reduce the spread. They were assisted by the behavioral change. And so we need to underline that it's a very, very important issue. And of course, the additional measures are going to be out for discussion. And so when the cabinet has concluded, the president will announce all the issues that would have been deliberated and taking into account all the contributions that have come from our health workers on the ground who are overloaded, the support that is needed for them, as well as the comments from traditional leaders, from religious leaders, from municipalities that we have been consulting all along, and provincial government that have sent to us submissions of what they believe would help us in containing this situation. I think that South Africans, as citizens, we need to say to ourselves, let us look at what is it that we can do so that we can embrace the guidance that we're given, as well as the change, the behavioral change that is necessary, so that whilst we enjoy, we must not endanger the lives of more South Africans, expose them to more infections and expose them to the risk of losing their lives. This is a time when we should really act very responsibly.
Okay, thank you very much, Minister. It's unfortunate we could not get newsroom through, but unfortunately we do need to let you go. But thank you very, very much for this very important public service announcement. And I do hope that all South Africans will take heed and take care out there. Thank you very much, Minister.
Thank you very much.